Hello, everyone, and a very warm welcome to you all. It's so lovely to have you join us today for our webinar, Understanding Continence, Knowledge, Confidence, and Everyday Freedom. My name is Beck Minahan, and I work with Catholic Healthcare's Home and Community Services team. I have the pleasure of coordinating our client webinar series and being your host for today's session. And we're really grateful to have you here with us today. Before we begin, I'd like to acknowledge the traditional custodians of the land on which we're meeting today and pay my respects to elders past and present. I extend that respect to any Aboriginal and Torres Strait Islander people here joining us today. So we know this topic can feel quite personal and sometimes even a little difficult to talk about openly, but it's also something that affects so many people and often much more commonly than people realise. Many older people experience changes with bladder or bowel control as they age, following illness or surgery, with certain medications or health conditions, or alongside mobility and strength changes. And while these changes are common, they can sometimes quietly affect comfort, confidence, independence, sleep, social connection, and everyday life. People may start avoiding outings, worrying about accidents, rushing to the bathroom, or feeling less confident doing the things they normally enjoy. So today is really about having a supportive, practical, and reassuring conversation. Our hope is that everyone leaves today feeling informed, encouraged, and aware that there are practical supports and strategies that can help. Just before we begin, a couple of quick housekeeping points. Today's session is being recorded, and we'll send the recording out afterwards to everyone who registered. Your cameras and microphones will remain off throughout the webinar, so you can simply sit back and listen comfortably. Please feel free to pop questions into the Q&A section throughout the session. Now, we completely understand that continence can feel like a very personal or private topic for many people. So if you would prefer your question to remain anonymous, there is an option to submit your question anonymously through the Q&A function. And we'll pause towards the end of the Q&A, towards the end of the session, for the Q&A discussion with our guest speakers. And if we don't get through every question live here today, please don't worry. We'll do our very best to include answers in the follow-up information sent out afterwards. I also wanted to mention that June includes World Continence Week, which is recognised each year to raise awareness of bladder and bowel health and encourage more open conversations about continence. It's a really important reminder because continence concerns are incredibly common, yet they are often something that people feel uncomfortable discussing or seeking support for. Hopefully, today's webinar helps normalise those conversations and provides practical information about the supports and strategies available. Today, we're lucky to be joined by a wonderful panel with different areas of expertise and experience supporting old people at home. We have Mandy, our registered nurse. Unfortunately, our physiotherapist is on unplanned leave today, so our fabulous occupational therapist is wearing two hats today. So Sabrina will be speaking on behalf of our physiotherapist and also under her expertise of occupational therapy. And then we also have Sonia, our care partner. Thank you all so much for being here with us today. So before we move into the practical strategies and supports, I thought it might be helpful to begin with what continence actually means, why changes can happen, and why early conversations are so important. So I might hand over to Mandy now, our registered nurse, to start us off. Mandy, can you explain a little bit about what continence actually is and some of the common causes people experience as they age?
Thank you, Beck. Hi. As Beck mentioned earlier, this is something that affects many people, but it's also a topic people often don't feel comfortable talking about openly. So quite often, people try to quietly manage things on their own for a long time before seeking support or advice. Put simply, incontinence refers to difficulty controlling the bladder or bowels. That can lead to leakage, urgency, accidents, or not making it to the toilet on time. For some people, it may happen only occasionally, but for others, it becomes more frequent, and that can start affecting everyday activities such as sleep, makes them feel uncomfortable, and their confidence. There's also different ways continence concerns can present. Some people may experience leakage when coughing, laughing, sneezing, lifting, or exercising. Others may experience a sudden urgent need to get to the toilet quickly. Some people may notice that they're going to the toilet much more frequently, including overnight. Others may have difficulty fully emptying their bladder, constipation, bowel accidents, or a combination of bladder and bowel concerns. And for some people, the issue may be more functional. So that means the bladder or bowel may not be their only concern. The person may have mobility challenges, pain, balance concerns, arthritis, vision changes, or memory changes that make it harder to get to the toilet safely or on time. So, continence is not just about the bladder or the bowel itself. It often connects with a person's overall health, mobility, routines, and daily life. There are many reasons continence changes can happen, particularly as people get older. As we age, changes in muscle strength, mobility, balance, pelvic floor function, cognition, medications, and chronic health conditions can all contribute. Some common contributors we often see include reduced mobility or slower walking speed, arthritis or joint pain, falls or fear of falling, dementia or memory changes, stroke or neurological conditions, diabetes, constipation, prostate conditions in men, and pelvic floor weakness, certain medications, recurrent urinary tract infections, and vision changes that make it harder to safely navigate to the bathroom. Sometimes it may also be related to difficulty managing clothing fasteners or transferring safely or getting on and off the toilet. And often it's not just one single cause. It can be several smaller changes happening together over time. For example, someone may have mild urgency, but also slower walking speed, arthritis in their hands, and difficulty managing clothing quickly. Each of those things on its own may seem small, but together they can make toileting much more difficult. Often, simply understanding why these changes are happening can help people feel less overwhelmed and more confident having conversations and seeking support early.
Thank you, Mandy. And sometimes these changes can happen quite gradually, and people may not always recognize what support could help. So I might ask you next, what are some of the early signs or changes people and their families should look out for when it comes to continence concerns?
That's a really important question. Thank you, Beck. Because often the early signs can be quite subtle at first. Some people may notice that they're needing to rush to the toilet more often, or they're feeling much stronger sense of urgency than they used to. Others may begin waking more frequently overnight to use the bathroom, or notice the occasional leakage when coughing or sneezing, laughing, lifting, or exercising. Sometimes people start wearing continence pads for just in case, even if accidents are still only occasional. Families or carers may also notice changes such as increased trips to the bathroom, more near misses or accidents, some damp clothing or bedding, a stronger odour in the home or laundry, skin irritation or redness, constipation or bowel changes, increased rushing behaviours, or someone becoming more reluctant to leave the house or participate in activities they previously enjoyed. Sometimes families may also notice increased confusion or agitation, particularly if a urinary tract infections are occurring. Sometimes the signs aren't directly about the bladder or bowel itself. Changes in mobility, balance, memory, dexterity, eyesight, or the ability to manage clothing and transfers can all start affecting continence and toileting safety over time. One of the biggest things we encourage is not waiting until the symptoms become severe before seeking support. Often, small changes identified early can be so much easier to manage and may help prevent complications such as balls, infections, skin issues, or a further loss of confidence.
Thanks, Mandy. And you mentioned skin irritation and skin breakdown there as well, which I think is another really important area people may not always realize can be connected to continence changes. Could you talk a little more about how continence can affect skin integrity and some of the signs people or families should look out for early?
Skin health is a really important part of continence care, but it's something people often don't think about until problems start developing. When the skin's exposed to moisture for long periods, whether it's urine, feces, perspiration, or even damp continence products, it can become irritated and fragile quite quickly. And over time, that can lead to redness, soreness, rashes, itching, discomfort, fungal infections, or skin breakdown. For older adults, particularly, the skin naturally becomes thinner and more delicate with age, so it can be much more like vulnerable to damage. If someone also has a reduced mobility or spends longer periods sitting or lying down, they have poor circulation, or they've got diabetes, or just difficulty changing continence products, then their risk can increase even further. Some of the early signs people or families might notice include redness, irritation, sore or broken skin, itching or burning, increased sensitivity or pain, rashes, moist or fragile skin, or changes in odor. Often people may feel embarrassed talking about these concerns, so problems can be more advanced before anyone seeks help. But early management is really important because once the skin starts breaking down, it can become painful, more difficult to heal, and may increase the risk of infection or pressure injuries. There are many practical things that can help protect skin integrity, such as regular changing of the continence products, gentle cleansing, drying of the skin, using appropriate barrier creams where recommended, wearing breathable products and clothing, managing constipation or diarrhea, supporting regular toileting routines, just staying hydrated and ensuring people have the right level of support if mobility or dexterity has changed. The important message is that changes should not be ignored or simply seen as part of aging. Early support and simple changes can make a significant difference to comfort, healing, and overall well-being.
And I think people would probably also be wondering if someone is already experiencing skin irritation or skin breakdown, what can a nurse actually do to help?
Often, early nursing support can make a really significant difference before skin concerns become more serious or difficult to manage. One of the first things the nurse will usually do is assess the skin carefully to understand how severe the irritation or the breakdown is and what may be contributing to it. That might include looking at how much moisture the skin's exposed to, the type of continence concerns occurring, mobility and pressure risks, current continence products being used, hygiene routines, nutrition and hydration, any existing health conditions such as diabetes or poor circulation, and whether there are any signs of infection or pressure injury developing. Because in order for the skin to heal properly, we also need to reduce the things that are continuing to irritate or damage it. That may include improving continence management, reducing prolonged moisture exposure, managing pressure areas or addressing issues such as infections, constipation, diarrhea, or poor nutrition. From there, the nurse can help develop a practical plan to support healing and protect the skin moving forward. But that may also include keeping the skin clean and gently dried, supporting more regular changing of continence products, recommending more appropriate continence products or using barrier creams or protective products, educating around gentle cleansing and drying techniques, and monitoring for signs of infection or worsening breakdown. Using appropriate dressings if the skin has become broken, helping reduce pressure or friction on vulnerable areas, supporting repositioning where mobility is reduced, coordinating pressure relieving equipment if needed, encouraging good hydration and nutrition, supporting referrals to the GP, wound specialist, or other allied health teams where needed, and helping carers understand how best to support skincare safely and respectfully. A really important part of nursing role is the ongoing monitoring, because skin can sometimes deteriorate quite quickly if underlying concerns aren't addressed. And often relatively small changes, such as more frequent product changes, better fitting continence aids, pressure relief, or protective creams can make a noticeable difference to comfort, healing, and overall well-being.
And I think that's really reassuring for people to hear, because sometimes continence concerns can start to feel quite overwhelming, particularly if someone has been trying to manage things quietly on their own for a long time. So from a nursing perspective, Mandy, what are some of the practical strategies or changes that can help improve continence and comfort day to day?
I think one of the biggest things people should know is that continence management is rarely about one single solution. It's usually about finding a combination of strategies that work best for the individual person and their daily routine. Some practical strategies that can really help include establishing regular toileting routines and avoiding waiting until urgency becomes severe. Hydration is also incredibly important. A lot of people understandably start drinking less because they're worried about leakage or frequent toileting. However, concentrated urine can actually irritate the bladder further and sometimes worsen urgency and discomfort. Managing constipation is another really important factor, because constipation can place additional pressure on the bladder and contribute to continence concerns. Medication reviews can also be helpful, as some medications may increase the urgency, frequency, drowsiness, or confusions. We also often talk about practical day-to-day strategies, such as planning regular toilet breaks, monitoring for symptoms and patterns, wearing clothing that is easier to remove quickly, or using continence products that are comfortable and appropriate, and seeking support early if symptoms are changing. Importantly, continence concerns should always be looked at in the context of the person's overall health and well-being. Often there are several contributing factors occurring together, and sometimes relatively small adjustments can make everyday life feel so much more manageable.
So if someone listening today is experiencing some of these concerns and they bring them up with a nurse, what does that process actually look like, and what kinds of things would a nurse usually do to help assess what's going on and support the person moving forward?
That's a really good question. And I think sometimes people imagine it's going to be, very clinical or uncomfortable conversation, but often it simply starts with talking openly about what's been happening and how it's affecting day-to-day life. From a nursing perspective, the first step is understanding the full picture of what the person is experiencing. We'll often ask questions about, what symptoms are occurring or how long the changes have been happening, whether there are certain triggers or patterns, what their fluid intake is like or their toileting habits, bowel health and constipation, what medications they take, are they experiencing any pain or burning, infections, or any skin concerns, how their sleep is overnight and their overnight toileting, have they had any falls or are they rushing to the bathroom, and how symptoms are affecting everyday life. A nurse may also look at skin integrity, any signs of infection or dehydration, whether current continence products are appropriate, changes in mobility or overall health, and whether additional supports may now be beneficial. From there, the nurse can help put practical strategies in place and monitor how things are progressing over time. That may include education and continence advice, some toileting routines or bladder diaries, supporting hydration and bowel management, skincare support, monitoring symptoms and changes, reviewing continence products and making sure they fit, identifying when medical review may be needed, and coordinating referrals where appropriate. For example, if mobility, balance, transfers, or falls risk are contributing significantly, the nurse may recommend physiotherapist or an occupational therapist input as part of the broader support plan. Or if there are any concerns around infections, medications, pain, prostate issues, or ongoing deterioration, a referral back to the GP or the specialist may be recommended. Often the nursing role is about helping identify concerns early putting in the practical supports in place and just monitoring the changes over time.
Thank you so much, Mandy. I think what's been really helpful about everything you've shared today is understanding that continence care isn't simply about managing symptoms. It's about understanding the person as a whole and identifying what may be contributing to the changes and putting practical supports in place early. One of the themes that has come through several times today is connection between continence, mobility, balance, and falls risks. So I'd like to bring in our occupational therapist on behalf of our physiotherapist into the conversation. So Sabrina, from what would be a physiotherapist perspective, or from your perspective, could you start by talking a little bit about the connection between continence and falls risk?
Yes, this is actually a connection that surprises lots of people. When we think about falls, we often think about poor balance, muscle weakness, slippery surfaces, or trip hazards around the home. But needing to get to the toilet urgently can also be a significant contributor to falls, particularly for older people. We often see people rushing to the bathroom because they're worried about not making it in time. That urgency can lead to people moving more quickly than they safely can, forgetting to use walking aids, not turning on lights overnight, or attempting transfers when they're feeling tired, dizzy, or unsteady. Nighttime toileting is a particularly common risk. Many falls occur when people get up quickly from the bed, are still drowsy, and are trying to reach the bathroom as quickly as possible. So physios and also occupational therapists, we often look at questions such as, is the person able to get to the toilet safely and independently? Has their walking speed changed? Are they feeling unsteady when turning or changing direction? Is getting on and off the toilet becoming more difficult? Are they avoiding movement because they're worried about accidents? Have they experienced any recent falls or near misses? Because often it's not the continence issue itself, that causes the fall. It's the rushing, reduced mobility, weakness, balance difficulties, or fear that develops around it. Another thing we commonly see is people becoming less active because they're worried about symptoms. They may stop attending exercise groups, walk less often, or avoid social outings. Unfortunately, over time, this can lead to reduced strength, reduced balance, and increased falls risk. That's why maintaining mobility and physical function is so important. The stronger and more confident someone feels moving around their home and their community, the easier it often becomes to manage toileting needs safely.
It sounds like maintaining strength, balance, and mobility can play a really important role in helping people get to the toilet safely and confidently while also reducing falls risk. So when a physiotherapist identifies some of those challenges, what support or interventions can a physiotherapist provide?
Yeah, one of the biggest things physios look at is whether someone can safely and confidently get to and from the toilet. That might sound simple, but there are actually a lot of physical skills involved. For example, getting out of the bed safely, standing from the chair, walking to the bathroom, turning safely, managing the clothing, sitting down, and standing up from the toilet. If any of those tasks become more difficult, continence concerns can become much harder to manage. So physios, they will assess strength, balance, walking ability, transferability, falls risk, endurance, and fatigue. They will then work with people to improve these areas through targeted exercises and practical strategies. Sometimes even small improvements in leg strength, balance, or walking confidence can make it much easier to get to the toilet safely and on time. For example, one exercise many people may be familiar with is the sit-to-stand exercise, where someone repeatedly stands up from a chair and then slowly sits back down again. It sounds simple, but it's actually training one of the most important everyday movements we perform. This exercise helps strengthen the muscles in the thighs, hips, and buttocks, the same muscles you'll be using when getting out of bed, standing from a chair, getting on and off the toilet, climbing steps, and maintaining balance while walking. Another example might be a supported squat, so squatting while holding onto a kitchen bench or sturdy surface. Again, this helps strengthen the larger muscles in the leg and improve balance and stability. Over time, stronger legs can mean getting to the bathroom more safely, feeling steadier when turning, greater confidence moving around the home, less reliance on furniture for support, and reducing your falls risk. Often these improvements don't just help with continence management, but they improve overall independence and function as well.
Thanks, Sabrina. And you mentioned exercises that can help improve strength, balance, and confidence. Another type of exercise many people may have heard about is pelvic floor exercises. And I think there are also a lot of questions and misconceptions around them. For example, is there an age where it's too late to start? Can they be effective for older adults? And do people need professional guidance to make sure they're doing them correctly? Could you explain a little more about pelvic floor exercises and how physiotherapy can help?
Yeah, that's one of the biggest myths, is that if you've reached a certain age, there's no point starting pelvic floor exercises. But the good news is that's not true. Just like any other muscle in our body, the pelvic floor muscles can still respond to exercise and strengthening later in life. Maintaining pelvic floor strength can be particularly important as we age because these muscles help support bladder and bowel control, pelvic organ support, and overall core stability. Many people don't realize that the pelvic floor forms part of our body's core muscle system, working together with the abdominal muscles, back muscles, and diaphragm to help provide stability and support for everyday movement. So when these muscles are functioning well, they can contribute not only to continence, but also to confidence, mobility, balance, and maintaining independence. The pelvic floor is a group of muscles that sit at the base of the pelvis and help support the bladder, bowel, and other pelvic organs. These muscles play an important role in helping us control when we empty our bladder or bowels. Over time, these muscles can become weaker due to aging, surgery, chronic coughing, reduced physical activity, or certain medical conditions. When they aren't working as effectively, people may experience urgency, leakage, reduced bladder control, or difficulty reaching the toilet in time. One thing that's really important to understand is that pelvic floor exercises aren't simply about squeezing as hard as possible. Many people are unsure whether they're exercising the correct muscles at all. Some people might hold their breath, tighten their stomach muscles, squeeze their buttocks, or use their legs instead of activating the pelvic floor itself. Another common misconception is practicing by repeatedly stopping urine mid-flow stream. While this may occasionally help identify the correct muscles initially, it shouldn't be used as a regular exercise technique. Repeatedly interrupting bladder emptying can interfere with normal bladder function and may contribute to incomplete bladder emptying, which can increase the risk of urinary tract infections. That's one reason professional guidance can be so valuable. When someone speaks with a physio, the assessment is usually very practical and non-invasive. So the physio will talk to you about your symptoms, bladder and bowel habits, mobility, medical history, medications, daily routine, and how symptoms are affecting your day-to-day life. From there, they can develop an individualized program that can include pelvic floor exercises, mobility training, strength exercises, balance work, and bladder retraining strategies. And perhaps the most important takeaway is that it is never too late to start.
And you mentioned bladder retraining strategies, which I imagine may be a new concept for some people. Could you explain what bladder retraining is and how it can help people better manage urgency and frequency?
Mm-hmm. Yeah, bladder training is essentially about helping the bladder develop healthier habits and improving a person's ability to manage urgency and frequency. Many people experience a cycle where they start going to the toilet just in case or rush as soon as they feel the urge. Over time, the bladder can become used to emptying more frequently, even when it actually isn't full. As a result, many people find themselves needing to visit the toilet more often, feeling stronger urges, or becoming anxious about where the nearest toilet is. Bladder retraining aims to gradually improve bladder capacity and help people feel more in control of those urges. We could be looking at your current toileting patterns and identifying trends. Sometimes a simple bladder diary can even be useful. From there, you might work on establishing more regular toileting routines, gradually increasing the time between toilet visits, managing urgency without rushing, improving confidence when urges occur, and identifying triggers where appropriate. Importantly, bladder retraining isn't about ignoring the urge to go to the toilet. It's about helping the bladder and the brain work together more effectively so people feel more in control. For many people, this can reduce urgency, improve confidence, decrease frequent toileting, and make everyday activities feel less stressful.
One thing we've touched on a few times today is confidence. Do you ever see people becoming less active because they're worried about falling or having an accident? And how does physiotherapy help rebuild that confidence?
Yeah, confidence is one of the biggest things to work on. Sometimes after a fall or a near miss or a continence accident, people naturally become more cautious. They may stop walking as much, avoid social outings, stop attending exercise groups, or become more reliant on others than they really need to be. And while that's completely understandable, over time it can lead to reduced strength, reduced balance, and even less confidence. Part of physiotherapy is helping people rebuild their trust in their body. You'll do this through gradual, achievable goals and exercises that improve strength and balance and mobility in a safe and supported ways. One of the most valuable things physiotherapy can provide is a personalized exercise program. This is tailored to the person's goals, abilities, health conditions, and current level of function. It might focus on improving leg strength, improving balance, improving walking ability and walking confidence, reducing falls risk, improving transfers, building endurance, and maintaining independency. Importantly, these programs don't need to be complicated. Sometimes a small number of targeted exercises completed consistently can make a significant difference. As people begin to feel stronger and more capable, their confidence often improves as well. And that confidence can have a positive impact in many areas of life, not just continence management, but independence, social connection, and overall well-being. We can also work with family members and carers to help them understand how best to support mobility and independence where needed.
Lovely. Thank you, Sabrina. It's really helpful hearing about the role strength, mobility, balance, pelvic floor health, and bladder retraining can all play in supporting continence and helping people remain safe at home. But even when someone has the right strategies and exercises in place, the home environment itself can sometimes create additional challenges. So, Sabrina, if you can take off your physio hat and pop your occupational therapist hat on now, from an OT perspective, how can changes to the home environment, daily routines, and assistive equipment help support continence, confidence, comfort, and independence?
So one of the first things occupational therapists look at is the person's environment and daily routines. Because sometimes the challenge isn't simply bladder or bowel control itself, it's everything that happens between feeling the urge to go and actually reaching the toilet safely. When we visit someone at home, we're looking at the entire journey. For example, how far is the bathroom from where they spend most of their day? Is the pathway clear? Is there enough lighting? Are there steps, rugs, cords, or clutter creating obstacles? Is there enough room to safely use a walking aid if needed? Can they open the bathroom door easily? Or are they struggling with clothing or fasteners? Sometimes people are surprised by how many small things can contribute to continence challenges. For example, I worked with someone who was experiencing regular accidents overnight. At first they thought it was just a bladder issue, but after looking at their environment, we discovered they were navigating a dark hallway, avoiding turning the lights on because they didn't want to wake their partner, and then trying to rush to the bathroom. Simply improving the lighting and removing a few of the obstacles made a significant difference to safety and confidence. So sometimes it's not about changing the person, it's about changing the environment around them.
And if the home environment is contributing to some of these challenges, what types of home modifications might an occupational therapist recommend?
So home modifications are often about reducing the physical effort required to safely access the toilet and maintain independence. Many people hear the term home modifications and immediately think major renovations. In reality, many modifications are very simple. For example, if someone has arthritis in their knees or reduced leg strength, getting on and off the toilet can become difficult and tiring. Installing grab rails can provide additional support and stability. For someone experiencing urgency, even a few extra seconds spent struggling to stand up or steady themselves can feel incredibly stressful. Another example might be improved lighting. A person might be getting up 3 or 4 times at the night to use the bathroom. By improving the lighting between the bedroom and the bathroom, we can often reduce falls and help them feel much more confident moving around at night. Sometimes we might recommend handrails, threshold modifications, removing trip hazards, or improving access on pathways. The goal isn't to make the home look clinical, it's about creating an environment that works with the person rather than against them. And often these relatively small changes can have a surprisingly large impact on safety and ease of living.
You also work with people around assistive technology and equipment. Can you explain what types of equipment can help people manage continence more safely and confidently at home?
So there are actually many different types of equipment available, and often people aren't aware of the options until they speak with an occupational therapist. One of our roles is helping identify what challenges someone is experiencing and matching the right equipment to their individual needs, the home environment, and their goals. For example, a raised toilet seat increases the height of the toilet seat. This can be particularly helpful for people with arthritis or reduced leg strength or hip, knee pain or balance concerns. A standard toilet can actually be quite low, and getting on and off it requires a surprising amount of strength and stability. By slightly increasing the seat height, it can make toileting safer, more comfortable, and less physically demanding. An over-toilet aid is a frame that fits around the toilet and provides supportive armrests. This can be helpful for someone who is feeling unsteady, recovering from illness, or finding it difficult to push themselves up from the toilet independently. The armrests provide additional support and confidence when sitting down and standing up. For some people, particularly those with significant urgency, reduced mobility, or a long distance between the bedroom and the bathroom, a bedside commode might be appropriate. Bedside commode is essentially a portable toilet positioned close to the bed. This can be particularly useful overnight when people may be tired, unsteady, or at increased risk of falls while trying to reach the bathroom quickly. Another option is waterproof mattress protectors or waterproof bedding to protect mattresses and furniture from accidents. This will reduce stress and anxiety that many people experience around overnight leakage. It can provide reassurance and make cleanup much easier. And a continence alarm is a device that detects moisture and alerts either the person or their carer where assistance might be needed. They can be particularly helpful for people living with dementia, people who may not recognize the need to go to the toilet, or in situations where reducing prolonged exposure to moisture is important for maintaining skin integrity. The most important thing to remember is that equipment should never be a one-size-fits-all solution. What works for one person may not be appropriate for another. So that's why occupational therapists take the time to understand the person's ability, their home environment, routines, and goals before making recommendations.
Thanks, Sabrina. And then beyond equipment and modifications, how can occupational therapists help people establish routines and strategies that make toileting easier and more manageable?
Yeah, another part of occupational therapy is looking at routines and habits. We spend a lot of time understanding how people move through their day and identifying opportunities to make things easier. For example, someone may routinely leave going to the toilet until the last possible moment, or they might keep frequently used items in areas of the home that require unnecessary walking or effort. Sometimes simple adjustments to daily routine can make a big difference. So that might involve planning regular toilet visits throughout the day, building toileting into existing routines, thinking ahead before going out, organizing the home to reduce obstacles, or simplifying clothing choices if buttons, zips, or belts are becoming difficult. For example, if someone has arthritis in their hands, this might not actually be getting to the bathroom. It may be the time taken to undo the clothing when they get there. So these small practical solutions can often reduce frustration and make everyday tasks easier to manage.
One thing that often comes up when discussing continence is the impact it can have on dignity in everyday life. How does occupational therapy help maintain their independence while continuing to feel comfortable and in control?
Yeah, I think one of the most important things to remember is that continence concerns don't change what is important to a person. So people still want to spend time with their family, friends, go to appointments, go shopping, travel, participate in activities, and enjoy the things that give their life meaning. The occupational therapy role is really about helping people continue doing these things in a way that feels manageable, safe, and achievable. Sometimes that means modifying the environment, sometimes it means introducing equipment, or sometimes it's about adjusting routines or finding simpler ways to complete a task. For example, someone may have stopped attending a weekly activity because they're worried about getting to the bathroom in time. Together, we might look at strategies, equipment, planning, environmental supports that help remove some of those barriers. A big part of occupational therapy is helping people maintain choice and control over their daily lives. Rather than focusing on what someone can no longer do, we're focusing on identifying what they can do and what supports might help them continue doing it. Everything we've discussed today, so home modifications, assistive technology, environmental recommendations, and practical strategies, is really aimed at supporting participation in everyday life. Because ultimately, occupational therapy isn't about doing things for people, it's about helping people continue doing the things that matter most to them in the way that works best for them.
Lovely. Thank you so much, Sabrina. I think what really stands out from everything you've shared is that sometimes the smallest changes can have the biggest impact, whether that's modifying the home environment, introducing the right equipment, or making everyday routines a little easier. Those changes can help people feel safer, more comfortable, and better able to continue doing the things that matter most to them. So thank you. So we've heard today about the different ways nurses, physiotherapists, and occupational therapists can support people experiencing continence concerns. But many people listening today may be wondering what to do next if any of this sounds familiar, or perhaps they're supporting a family member and aren't quite sure where to start. So I'd like to speak with our care partner, Sanya, now. Sanya, for people listening today who may be experiencing some of these challenges themselves, or perhaps are concerned about a family member, where can they start?
Thank you, Beck. And I think the first thing I'd say is that you don't need to have all the answers before reaching out for support. Often people wait until things have become quite difficult because they are unsure who to talk to or whether their concerns are significant enough. But sometimes a simple conversation is the best place to start. For many people, that might be speaking with their GP, particularly if symptoms are new and changing or beginning to affect daily life. For many, a GP can help identify whether there may be medical causes contributing to continence concerns and can arrange further assessments if they are needed. For people receiving aged care services, there may also be a range of supports available that can help address some of the challenges we discussed today. For example, nursing support can help assess continence concerns, monitor skin integrity, provide education, and identify changes that may require further medical review. Physiotherapy can assist with mobility, strength, balance, fall prevention, pelvic floor exercise, and bladder retraining strategies. Occupational therapy can provide recommendations around equipment, assistive technology, home modifications, and environmental changes that make toileting easier and safer. But support isn't always about clinical services either. Sometimes it's practical day-to-day assistance that make the biggest difference. For example, personal care services can assist with showering, dressing, continence care, changing continence products, and maintaining skin integrity where needed. And domestic assistance can help with additional laundry, linen changes, cleaning, and maintaining a safe and hygienic home environment. We've also spoken about equipment and home modifications, which can help make everyday activities easier, safer, and more manageable. Often, it's not one support that makes difference. It's having the right combination of supports working together to meet the person's individual needs and goals.
That's really helpful. Thank you. And I think one thing that often reassures people is knowing they don't have to figure everything out on their own. So can you tell us a little more about how care partners help coordinate those supports and navigate the system?
Yes, for clients receiving services, your care partner can often be the central point for contacts to help identify concerns, coordinate support, and connect you with the right services. For example, if you mention changes in continence, increased urgency, difficulties getting to the toilet safely, skin concerns, changes in mobility, or concerns about managing at home, your care partner can help arrange referrals to the most appropriate supports. That may include nursing, physiotherapy, occupational therapy, equipment assessments, home modifications, or discussions with your broader healthcare team. You don't necessarily need to know who to contact or what services you need. That's something we can help you guide you through. We often find that people aren't always aware of the range of continence products that are available. Many people assume that products they see in the supermarket are the only options available, but in reality, there are many different products designed to suit different needs, lifestyles, and levels of support. I remember speaking with one of the clients who asked if we could start ordering large continence aid. So they were using pads and wanted large instead of medium ones. I remember that we talked a little more about why, and she explained that she had been wearing a large pad over the top of her medium pad because she didn't feel the medium product was providing enough protection. What she didn't realize was that there were many products available in her size that offered much more absorbency and better suited for her needs. Once we connected her with a more appropriate product, she no longer needed to layer the pads and found them much more comfortable and felt much more confident going about her day. It's a great example of how sometimes the solution isn't necessarily using more products. It is finding the right product. We can help people explore different options and in many cases arrange free product trials to see what works best for them and even before committing to a particular product. Finding the right product can often make everyday life more comfortable, practical, and manageable. Another practical way we can assist with is ongoing continence aid management. For clients who are receiving supported home funding, we can assist with ordering eligible disposable continence products and ensuring those supplies continue to arrive when needed, rather than expecting clients or families to call us and to remember actually when products are running low. We can set reminders for us and team to check in, review usage, and arrange reordering before supplies run out. That helps a lot and provides peace of mind and ensures people have ongoing access to the products they rely on every day. And if needs change over time, we can also help review products to ensure they are still the right fit. And for anyone who feels uncomfortable about deliveries arriving at their home, products can often be delivered in discreet, unmarked packaging. There are no obvious labels or branding on the outside of the box, so nobody is actually aware what you have ordered. Sometimes it's those small practical details that can help people feel more comfortable accessing the support they need. We can also work with clients to tailor services around their continence needs and daily routines. For example, if someone enjoys getting out into the community but is worried about access to toilets, we can consider that when planning services and outings. We may help schedule activities around established toileting routines, identify suitable locations with accessible facilities, or adjust timing to help the person feel more comfortable. For clients requiring assistance with continence care, we can arrange appropriately trained staff to provide support with changing continence products and personal care, always in a way that maintains dignity, privacy, and respect. Because ultimately, the goal isn't simply to manage continence concerns. It's about helping people continue living the life they want to live while feeling supported and comfortable along the way.
Lovely. Thank you, Sanya. That's really reassuring to hear. So for someone listening today, whether they're already receiving services, receiving support through another program, or simply beginning to explore what help might be available, what would you recommend as their next step?
That's a great question. And the good news is that people don't need to know exactly what services they need before reaching out. Often, first step is simply having a conversation. For clients that are already receiving support with Catholic Healthcare, I would encourage you to speak with your care partner. And we can discuss any concerns, identify changes that may be occurring and explore whether additional supports, assessments, referrals, equipment, or services may be beneficial. For people who are receiving Commonwealth Home Support Program services or those who may not currently be receiving aged care services, speaking with GP or contacting My Aged Care would be probably the best starting point. Every person's situation is different, and there isn't a one-size-fits-all solution. Our role is to help understand the person goals and identify what may be contributing to the challenges they are experiencing, and connect them to the right supports to help them remain safe, comfortable, and independent at home. And perhaps the most important message I'd like people to take away today is that continence concerns are very common and support is available. June is recognized as World Continence Month, which helps raise awareness of bladder and bowel health and encourage people to have these conversations earlier. That's important because many people delay seeking support due to embarrassment or because they assume it's simply a normal part of aging. But often early conversations and early support can actually make significant difference. Whether that's speaking with your GP, your care partner, or a nurse, physiotherapist, occupational therapist, or supporting a family member to seek help, I would really encourage you to not wait until concerns begin impacting your comfort, safety, and quality of your life. Because seeking support isn't about losing independence. In many cases, it's the one of the best ways to maintain it. And remember, you don't need to navigate this alone. We are here to help.
Thank you so much, Senya. I really appreciated your reminder that people don't need to navigate these challenges on their own. Knowing there is someone who can help coordinate supports, arrange referrals, and tailor services to individual needs can be incredibly reassuring. So thank you. We covered a lot of information today, and hopefully you've heard that continence concerns are common. There are many practical strategies available, and support can be tailored to each person's individual needs and circumstances. We're now going to pause for our Q&A session. If you do have a question, please feel free to type it into the Q&A function or the chat function there. As we mentioned at the beginning of today's webinar, we understand that continence can be a very personal topic. So if you would prefer your question to remain anonymous, please select the anonymous option when submitting your question. There are no silly questions, and if you've been wondering about something, there's a good chance that someone else listening today is wondering the same thing. So we'll do our very best to answer as many questions as we can during the time that we have available. And if we don't quite get to your question today, please don't worry. Following the webinar, we'll provide a summary of the questions and answers discussed, along with the responses to any questions we've answered to help cover off during this live session. So please feel free to ask away.
Beck, there is one question which has come in, which Mandy may be best to comment on if she can.
Okay.
Attendee's been leaking for 40 years, seen so many doctors and practitioners, nothing has helped. Often very painful. Have there been any advances in treatment?
What was that one? Sorry.
Been leaking for 40 years, seen doctors and practitioners. Are you aware of any advances in treatments, medications?
Male or female?
Female.
Look, there are many advances now with technology, there are some medications that they're trialing that help with bladder contraction and limiting, and the pad change, like the pad sizes and things like that now are much better than what they were back then.
Okay, we've got the name of that attendee, Beck, so we may take that offline and reach out directly.
Yeah.
There's a couple other questions about specialists in the area.
Yeah, lovely. All right, that sounds good. Thank you. Any other questions there? I'll give it a couple more minutes. We did have some questions come throughout the registration process. I might, Mandy, I have one for you here. Someone did ask, why do people get reoccurring diarrhea?
Ooh, there are many different causes for recurring diarrhea, actually. Some people just think that it's an aging process, but sometimes it can be related to infections, certain medications, some food intolerances, any type of bowel conditions or any underlying health conditions. Severe constipation is usually the biggest indicator for this, and it gives you a thing called overflow diarrhea, and that's just where stool leaks out around the impacted stool that you have in your bowel. And because of this, it just increases your risk of dehydration, skin irritation, and continence issues. And some people can even have falls as they rush to the bathroom. But if you are experiencing any ongoing or recurring diarrhea, I definitely encourage you to speak to your GP just to find out the cause. It may not be something as simple as overflow. There may be something more for it. But from a nursing perspective, we just have a look at things like hydration, your skin integrity, nutrition, medications, and any other additional supports that we can provide once identified.
Thanks, Mandy. I think we've had a few more questions come through there. Was there anything there, Anna?
I think this is a medical term. Can men overcome incontinence post-TURP? I'm not sure what TURP is. TURP.
Okay, so a TURP's actually a transurethral resection of the prostate. So often done when someone's suffering an enlarged prostate or prostate cancer can be another reason to have this done. They can, it's not uncommon for people to have any temporary changes in their bladder control, especially following that procedure. So some men might have more urgency or frequency, some leakage, may even be a little bit blood streaked in there at times, but the symptoms can improve over time, and recovery, it just varies from person to person. Like if continence issues persist, it's definitely speak to your GP or your specialist, because they may have some other treatments or strategies that would be or referrals for you that, could definitely help. But I guess one positive thing is support is always available. People don't need to just simply accept that ongoing symptoms is something that they have to live with.
Thank you, Mandy.
There is one more question, Beck. I'm mindful of time. Did we want to continue?
We probably just have time for, that last one. Thanks, Anna.
So another back to you, Mandy. How does not drinking cause urinary tract infections?
Okay, so by not drinking, what can happen is you develop irritation into your bladder. So because you become dehydrated, your urine itself can become more concentrated. So you're actually doing more damage and becoming a higher risk of being of having any continence problems by not drinking, because the more water we have, the more it can flush things out and the better it can be.
Lovely. Thank you, Mandy. And thank you, everyone, for those wonderful questions that came through. Please, if you still have questions, please keep typing them through, because we will respond to those following the session today. But just mindful of time, we have run out of time to answer those live. I do apologise. But thank you again to our wonderful panel for sharing their knowledge and practical advice today. If there were, any questions that we didn't get through, please don't worry, we will get through to those and send those out alongside the recording and other resources. So as we start to wrap up today's webinar, I'd like to briefly reflect on some of the key messages we've heard throughout today's discussion. Firstly, continence concerns are incredibly common. Many people experience changes to bladder or bowel function as they age, following illness or surgery due to health conditions, medications, mobility changes, or a range of other factors. Secondly, early conversations matter. Sometimes people delay seeking support because they feel embarrassed, unsure who to talk to, or assume it's simply a normal part of aging. But as we've heard today, understanding what's contributing to those changes can often open the door to practical solutions and supports. We've also heard that small changes can make a meaningful difference. So whether that's improving skincare, strengthening pelvic floor muscles, modifying the home environment, introducing equipment, adjusting routines, or accessing additional support services, often it's the combination of smaller changes that can have the greatest impact. And perhaps most importantly, support can be tailored to each person's individual needs, goals, preferences, and circumstances. There is no one-size-fits-all solution. What works best will be different for everyone. So before we finish, I'd like to share the remaining webinar topics we have planned for the year. Our webinar series has been designed to support healthy aging, independence, and wellbeing at home, and we would be delighted to have you join us again at any of these ones. You'll see on the screen that recordings are available for our previous webinars, including the Stay Connected and Thriving at Home, Stay Steady and Confident at Home, and Hearing and Vision Changes. If you missed any of those sessions, recordings are available, and registrations are now open for the remaining webinars planned throughout the year. You can register for upcoming webinars or access those previous recordings using that QR code on the screen. We will also send you out some more information about those upcoming ones. And if today's webinar has raised any questions or concerns for you, please don't hesitate to speak with your care partner, GP, or healthcare team. As we close today's webinar, I'd like to thank all of our guest speakers for sharing their knowledge, experience, and practical advice. Thank you to, excuse me, our registered nurse, our occupational therapist, and our care partner for helping us better understand the many ways continence concerns can be supported. And thank you for everyone who joined us today. We know continence can be a sensitive topic, and we genuinely appreciate you taking the time to be a part of this conversation. And if there is one final message we'd love you to take away, is that continence concerns are common, support is available, and people do not need to simply put up with symptoms that are affecting their comfort, well-being, or everyday life. Whether that's speaking with your GP, reaching out to your care partner, discussing concerns with a family member, or exploring some of the supports we've discussed today, taking the first step can often make a meaningful difference. So we hope today's session has been informative, reassuring, and empowering. Thank you again for spending part of your day with us today, and we hope you have a wonderful day and look forward to seeing you at another webinar soon. Take care, everyone. Bye-bye.